All right, folks, so acupuncture is considered an alternative treatment in the Western world, but is a traditional Chinese medicine practice for centuries. Here to show and tell us about it is Dr. Tracey-Ann Brown, acupuncture Chinese medicine physician with the Acupuncture Center, Jamaica. Morning, friend. How are you?
Good morning, Neville. How are you?
Can't complain. Good to see you.
Good. Same here.
Why you wanted to do this kind of medicine in the first place?
That's always an interesting question. I'd always wanted to do something in healthcare, something in healing, something that I thought would help people. And somewhere in sixth form, I developed an interest in Asian culture. So to me, it seemed like a natural merger of my interests. So after I finished my bachelor's studies at UA, I went on to study Chinese medicine.
Okay, and here you are now.
And here I am now.
Acupuncture, I said at the start, that's an alternative treatment to treat every single illness, or no?
Well, I don't usually deal with broken arms and joints, but it does treat a wide range of conditions. So, things ranging from musculoskeletal issues, respiratory issues, fertility issues. So the treatment range of Chinese medicine is vast.
I know you have a little pin needle. So what does that do? What? Because I mean, you put it all over the body.
Right.
So is the treatment itself, or is something run from the pin and the needle, and what happened?
Let me back up a little bit.
Yeah.
So just some background. There are close to 1,000 acupuncture points on the body.
1,000?
1,000 acupuncture points on the body. So they're on the front of the body, the back, the scalp, the ears, all over. Each of the acupuncture points will have a specific function. Mm-hmm. So you can treat a wide range of conditions with acupuncture needles. And the premise or the foundation is that you stimulate these acupuncture points to be able to treat the different systems or organs in the body that they relate to. So for example, there's a point right here between the index and the thumb that when stimulated can help with headaches. And by stimulate, I mean you insert the needle, you gently manipulate the needle, and of course, depending on where you're needling, you might needle to a different depth. So the depth of the needle on your hand is different from how deep you'll needle on the lower back or on the thighs. And in stimulating those points, you're able to affect the body and
in other words, it's not necessary that if it's right here, pain in me, you go and put the needle right
exactly
here. So right here could be pain in me, you put the needle up here.
Correct.
Oh.
Right. So for example, if you're having some trouble sleeping, there's a point in the ear called the Shenmen point, and I needle a point in the ear to help with sleep and relaxation.
It's a one treatment and or is a...
So it varies depending. So for chronic long-standing issues, often you're looking at a series of treatments. Sometimes a patient will come in once a week for treatment at the onset of treatment, and then thereafter we taper it depending on how the patient responds. If it's an acute issue that's not a major condition, you might just do one treatment and you're good to go. It's
not a preventative thing. In other words, you can't stop me from getting something if you joke me a couple of times.
I'm going to say no, but there's an interesting story to that. In ancient China, in the earlier days of Chinese medicine, the feeling was that you would go and see your Chinese medicine doctor, your acupuncturist, to prevent illness. And in fact, if you became ill, the doctor was looked down upon. In other words, you're supposed to prevent illness. I mean, the way we are in our current society, the posture is different. So we usually wait until something happens and then you treat it. But in older times, the idea was to prevent illness.
Some question never that done then?
It wasn't that done.
You have to agree with me. So what? Is how many needles you put in at a time? How long is the treatment? I just go sleep and wake up and I'm good again. What happens?
So usually, on average, 20 needles are inserted in the body.
No matter what's wrong with me, it's about 20.
Maybe less, maybe more. If you're doing cosmetic acupuncture, it could be a lot more on the face.
What is cosmetic acupuncture, please?
For those who are concerned about wrinkles and fine lines and sagging.
Oh.
That aside, usually acupuncture treatments would include about 10 to 20 acupuncture needles, more often than not 20. And the needles are inserted, you're left for 20 to 25 minutes, sometimes a little longer, and the patient rests.
Yeah.
Needles are removed, disposed of.
How do you know how deep to put it? You said already that in certain places it might be a little bit deeper.
So,
how do you know?
So with each acupuncture point, there's guidelines in terms of your needling depth, the type of needle you should use, the type of manipulation you will use.
Sorry to jump in. What do you mean by the type of needle? It's not the same needle for everyone?
Some are thinner, some are thicker.
Okay.
So on the face, you're going to use really thin needles.
Okay.
On the ear, you use thin needles.
Okay.
On the fleshier areas, you use thicker needles. If you're dealing with pain, you use thicker needles. On the face, you don't want to needle very deep, sensitive things around there. In the lower back, you could go a little deeper. On the buttock, you can go a little deeper. On the thighs, you can go deeper. On the ear, shallow. When you're close to skirting certain arteries, certain essentials, you don't go very deep at all.
Yeah.
And then the angle will vary. So if you're needling on the chest, which is, the heart and the lungs are right below there, particularly the lungs, you don't needle perpendicularly on the chest because you want to prevent a pneumothorax.
Okay.
Right.
Question now. It goes along with other medication, or is just acupuncture going to get you better done the argument? You don't give me no tablet.
The argument don't done there. One of the good things about acupuncture is that it works well with other types of therapies and interventions. So, for example, most of my patients come in with chronic issues, long-standing health concerns, and they're probably on medications, they're probably taking pharmaceuticals, they're probably doing physiotherapy or some other therapy. And often acupuncture is not contraindicated, and so you can do work together, which works out better for the patient, because sometimes one thing does not fix the situation that you're presenting with.
Okay.
And so a combination of therapies really is ideal for some patients.
Yeah. And ideally, before I bring in Garth, and you can joke him up with 2 needles for me, ideally, all things being equal, how long would a treatment, how many times I would say, ideally? I mean, as you already said, it's not one size fits all, I understand.
Right.
But if it's not the worst thing happened to me,
Right.
how much time I have to see?
So if it's not the worst thing that happened to you, and, so for example, you're playing a sport, you injured yourself, but it's an issue that comes back from time to time every couple of years. You come in, we look at perhaps 4 treatments, a week apart.
Okay.
And usually, I find that most people will respond or notice some improvement after the first acupuncture session.
Okay.
Now, sometimes it takes a second. And even if it is that you can't jump and skip and everything is perfect after the first, you usually can see some improvement.
Okay.
And then as we go along, you expect the condition to improve.
All right, I want you to go over to Garth.
Okay.
By the way, I am in a very serious way. I'm scared of needles, injections. How painful is it, if it's painful at all?
Most people are comfortable. The needles are pretty thin.
Joke
No
up that.
screaming going on, usually.
No, them on the properly for me now.
So no screaming?
Only if you want to scream.
No needle way, just put him to sleep till next week, Thursday.
No, I don't want to even get into that as the way. All right, so what I'm going to do perhaps 2 acupuncture points, just so you can have a sense of what it is like. Just rest your hand on your thigh here. I'm going to just clean the area. Let me just come here, more obvious. I'm going to leave your face alone.
All right, that's not bad. When you joke me, to go make me cuter?
We're on national TV.
I know.
I don't want to answer.
I know of joke that to that.
All right.
I shouldn't have so much needle.
All right, so I've cleaned the area.
Yes.
These are the shorter needles that I'm using today. So,
This needle that's about 3 inches long. Carry on.
but bear in mind you're on TV, so you shouldn't scream. Just joking. Just joking. All right, here we go. Very, very quick insertion. Usually, you go a little deeper. Yeah.
Okay.
And as I mentioned, there are close to 1,000 acupuncture points on the body, and what the needles selected depends on what we're trying to address.
Okay.
How was that?
That's not bad. Me not feel nothing.
Yeah.
So what these
So
supposed to know?
this particular point is a point usually indicated for headaches,
Headache?
migraines as well.
Oh, my wife could I use it?
Right, and this point as well can be used in conjunction with this point for headaches, migraines.
Let me an eagle, please.
No, no.
So how long you supposed to keep it in for?
Usually they will stay in for about 25 minutes.
Oh.
I'm no needle for make him look brighter than him is.
Yeah. Like
So there's a point here, do 20, that helps with focus and memory, and there are some points around it called the Sishen Kong points that help with poor focus, poor concentration,
wait.
memory issues.
No, like for real?
Let me
Yes.
an eagle, man.
Somebody can't come link it in.
And so sometimes
No, I mean, go ahead.
you want me to leave.
Yeah.
Yes.
I could use focus.
You could use some focus.
I'm
Right.
serious. Like, I really could.
So on that note, persons who perhaps struggle with ADHD or focus issues or attention issues, these 5 points here, the ones in the middle and the 4 surrounding it, are good points to help with that issue.
Someone have to shave up a mohawk?
No, man, I can work around
You
it.
can work around it?
I can work around it.
And then like when my skull tough and so how the needle go?
So when you needle, because the skull is there, you're not going to needle perpendicularly. You needle obliquely, so the needle runs out,
Under the flesh,
along
right.
under the skin,
Right, yeah, well, yeah.
and along the skull, so it doesn't puncture it can't puncture the bone,
right.
but it traverses.
Okay.
So, Doc, question now. Is it because of the pressure point that you find, or is there something at the end of the needle that has medication on it?
Right, that's a good question. So there's nothing being injected into the body, which accounts for it not being uncomfortable. But what is happening is that when you insert the needle, it stimulates the points. So the points, when you're palpating the acupuncture points, you'll know that there's a small dip, a little sink at the acupuncture points. So the acupuncture points are very specific in their location. And what happens is that you stimulate it by inserting the needle. Now, you put the needle in, you manipulate it in different ways depending on what you're trying to treat. So for example, if a person is coming in with a deficiency, what we call a deficiency, that they're weak, they're tired, they're fatigued, you do a certain slower manipulation. If there's a pain presentation, which we call an excess condition, it's a more robust kind of needling technique that is used. Either way, whatever the manipulation technique, you're manipulating the point, which then stimulates the meridian, which affects the organ and the systems it's related to.
Very well explained. Just before you go, quickly, just give me some of the ailments that can be treated by acupuncture.
Okay, so number one, popularly known, pain management. Pain management, whether it's due to joint pain, migraines, headaches, menstrual issues that create pain, anxiety, sleep disorders, blood pressure management, blood sugar management, but that's usually in conjunction with herbal therapies. Also, anything to do with fertility.
We are in
menopause.
Breast Cancer Awareness Month. Can it be treat cancer?
So acupuncture and Chinese medicine offers a lot of support with pain management for cancers, generally speaking, and
but
also during therapy.
By itself,
there are herbals. There are herbals that help to reduce tumors, but then that requires a more specialized kind of treatment and discussion, because you have to look at what's the best and the timing of the treatment, because sometimes surgery is indicated for cancer, chemo, radiation, and of course the timing of the different interventions become important.
Great to see you. Thanks for coming in. Acupuncture Chinese medicine physician with the Acupuncture Center, Jamaica, Dr. Tracey-Ann Brown. Thanks again. Coming up, we try out some fun at-home experiments. That not sound like it or end so good enough. but stay with us. We will tell you whether you should try it or not. So come.